What I want to do today is talk a little bit about this health care plan. And I just want to tell you before I start that at the end of that, and I'm going to try to keep it fairly short, I'm going to take your questions on anything you want to ask. And while health care is the focus of this discussion today, you can ask anything you want. You can ask about Iraq. In fact, I hope you do. You can ask about, my view about what America should be doing in the world, period. You can ask about jobs. You can ask about energy, whatever you're interested in. But I want us to talk about the whole range of concerns that you have. And I'm very happy to be back in Newton. As most of you know, I've been here a time or two. And I've seen a lot of you, and I'm very appreciative of you taking the time to come and engage in this discussion with us today, because I think we really are at an historic time in the history of the United States. And it's so important that in the next election we elect the right kind of leader. And I'll give you my own personal view about this, and sort of watched it up close for a while now. I think what America needs most in its next president, besides real ideas and vision, which are critical, but we also need the personal characteristics that we now need in a leader. And I think those characteristics are honesty and openness and decency. Somebody that we can trust. And I think it's critical not just for us, although I think it is critical for us, because we need to reestablish trust between the President of the United States and our people. But we need to reestablish trust between the President and the rest of the world, too. And I think those qualities are crucial. So let me begin by talking about health care. First, what we've got are 47 million people who don't have health care coverage. We've got insurance premiums that have gone up about 90% over the last 6 years. That's a pretty staggering increase in cost, way outstrips inflation. And we got a lot of people, even if they have health care coverage, they're scared to death they're going to lose it, right? Worried that, you may change jobs, that you may have a child or a husband or a wife with a pre-existing condition, and you won't be able to get the health care that you need. All these things are problems, lots of huge gaps in our health care system. Now, I'm proud of the fact that I have the first, and at this moment, the only, detailed substantive universal health care plan of any candidate, either Democratic or Republican. One of the things when you lead on issues, you sort of stick yourself out there, and there are always going to be some people who like what you do and some people who criticize what you do. But I want to say to everybody here, and I'm dead serious about this, the one thing you can count on from me, and you have my word on this, is when you go to the caucus in January of 2008, whoever you caucus for, and I want you to caucus for me, let me be clear about that, but whoever you caucus for, you are going to know where I stand, and you're going to know what it is I want to do for this country. And it will not be mushy, it will be absolutely clear. I'm going to lay out what I think needs to be done. I'm doing health care today, but it will not just be health care. The war in Iraq, I can tell you today in detail what I think we ought to be doing in Iraq. I can tell you what I think we ought to be doing in the rest of the world, what we ought to do about energy, all the things, climate change, all the things, jobs, all the things you're concerned about. You will know where I stand, and you can decide based on that and based on your evaluation of me, which is exactly how you should test me, whether you want me to be your president. And that should be the test. Now, here's what this universal health care plan does. Basically, it's founded on the idea of shared responsibility, which means all of us are going to have to play a role in having truly universal health care. The employer is required to cover their employees. If they don't, they have to pay money into a fund to provide for the coverage. The government plays a very important role, because what the government does is set up what's called health care markets all over the country. And those markets do several things. First, if you are a consumer, somebody looking for health care, or don't have health care, or you want to change, any of the above, you'll have a choice in these health care markets. There'll be a few private insurers, and there'll be a government choice. In other words, you can choose to have what essentially is Medicare Plus. If you'd rather not have a private insurer, you can do the government. I did that intentionally because there are a lot of people who believe that we should go from where we are now to a single-payer healthcare system because there are less administrative costs, there's in some cases better care. So we're going to give that choice to you. You can choose Medicare if that's what you want, or you can choose a private insurer. Second thing is we subsidize the cost of healthcare. If you're low income, it's almost complete subsidy, and as your income goes up, the subsidy goes down. It caps off at about somewhere between $90,000 and $100,000. But even if you earn $300,000 a year, you earn well over the cap, you still get a huge benefit from this universal health care plan. Because today, we spend more money on health care than any country in the industrialized world. And on the other end, we get a much less good product. So what we're going to do is create efficiencies that don't exist today. We mandate the use of technology, mandate electronic record keeping, lower administrative costs. We're spending 30 to 40% of every healthcare dollar on it, not for healthcare, but for administrative costs. That has to change. And then we fill in these deficiencies that exist in today's system. Complete mental health parity. Mental health will be treated exactly the same way as physical health. We cover chronic care, long-term care, which is a huge issue in today's healthcare system, and preventative care, which is also critical because what happens today is insurers don't have the incentive to cover preventative care because you move from one insurer to the other. And because this is a birth to death health care plan, you actually, in this case, there will be an incentive to cover preventative care, and we want people to get care throughout their lives and to be able to avoid some of the catastrophic health care problems that can occur. So those are the things we do. We fill in the deficiencies, we make sure everybody's covered, we provide support for health care costs, and then on this issue about worrying about losing your job or changing jobs, that kind of thing, if you have your health care in one of these health care markets, you can take the health care with you. If you change jobs, if you lose your job, whatever, you continue to have health care. And everybody, once the plan is fully implemented, and somebody may want to ask me about that, but once it's fully implemented, everybody in America will have health care coverage. Now, the cost, and I always say this because I said it earlier a few minutes ago, it's really important for us to be honest with people now. The cost of this is $90 to $120 billion a year. And I would say to all of you, when presidential candidates come roaring through Newton and claim they have a health care plan, you ask them what it costs, if they don't tell you. And you ask them how they're going to pay for it. Because somebody who comes through here and says, oh, we're going to give you health care, and we're going to change energy, and we're going to lift people out of poverty, and we're going to do this and that, and we're going to eliminate the deficit at the same time. Right. My plan costs $90 to $120 billion a year. I've got a way of paying for it. The way we pay for it is by rolling back Bush's tax cuts for the richest people in the country. There are some other smaller things that contribute to it, which I'll be happy to tell you about if you're interested. But the bulk of it comes from rolling back the Bush tax cuts for people who make over $200,000 a year. So that's basically the health care plan. The last thing I want to mention to you is sometime over the next few days you may be getting something in the mail from me, and it is a detailed description in writing of the plan because sometimes it's hard to remember all this. And secondly, there's a DVD in it, and if you watch the DVD, you'll hear more discussion about this. And the whole purpose of all that, and this, what we're doing today, is I want you to know the details and the specifics of what I want to do about health care when I'm president.